Right now on Face the State, coronavirus essentially shuts down Connecticut. The death toll has grown along with the number of those who have the virus. With us this morning to discuss, the president and CEO of Hartford HealthCare, Jeff Flaks. Also, Congressman Joe Courtney on what Washington is doing. Plus, the mayor of Hartford, Luke Bronin, joins us. His city hit with several positive COVID-19 tests. It's all straight ahead this Sunday, March 22nd, 2020.
From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning, everyone, and thanks for joining us. I'm Dennis House. Welcome to a special edition of Face the State, once again focused solely on the coronavirus crisis. First, the headlines today. 223 people in Connecticut have now tested positive for coronavirus, a jump of 29 since the last official numbers were released on Friday. 3,100 people have been tested, 43 are hospitalized, 5 people have died. The state is still looking for equipment to be donated, like masks, ventilators. They are looking for medical professionals to come out of retirement to help out. In 35 and a half hours from now, tomorrow at 8 p.m., the governor's Stay Safe, Stay Home program, executive order, will begin. That means only essential businesses can open. We have that list of essential businesses on our website. And right now, we want to bring in the president and CEO of Hartford HealthCare, Jeff Flaks, joining us now live from Hartford. And Mr. Flaks, good to see you here in the program this morning. Thanks for being with us.
Thank you. Good morning, Dennis.
I want to ask you, first of all, have you received any additional information about the number of cases in our state in addition to what we just reported?
It's an evolving process, Dennis. The cases are rising. We're seeing more people test positive, unquestionably, but it's still within our state a very dynamic process.
What is the situation right now at the hospitals that you are in touch with in terms of capacity and the ability to handle coronavirus patients?
First, I have to tell you, this is really a community event, and it's a regional response. All the hospitals across Connecticut are working very closely together in true partnership, and we're working very closely with the state of Connecticut, unquestionably. So at this point, there is capacity, but we're planning, and we're actively engaged, and we recognize that there will be great pressure on our systems, and we're figuring out new ways, more creative ways to take care of more patients within our existing facilities, as well as standing up and creating new auxiliary facilities to support more people who need our care.
There are so many people watching right now who are home worried about perhaps they have to come in for chemotherapy this week. Perhaps they have to come in for some routine surgery. Perhaps they're nearing their due date. What do you tell them to make them relax in terms of coming to the hospital in a situation like this?
First of all, I recognize all of our staff, all people who work in healthcare today. What's happening is truly remarkable. We are standing up and continuing to provide all of our services across our health system that are necessary, that are essential. So for people who have cancer care, for people who need heart and vascular care, stroke care, trauma, emergency care, these types of services are in place, stand ready, and our team are caring for people under all circumstances who are in need.
Let me ask you this in terms of, let's go through some of the list of the things that people are asking for. The governor and you have put out sort of an alert. If you're retired in the medical profession, we would like to see you come back in the field and help out. How is that going so far? What's the response been?
Dennis, it's been incredible. We've gotten so many inquiries and phone calls and people volunteering. Just late last evening, I had one of our longstanding intensive care specialists who's been retired for a number of years offer to do anything possible to help us during this time period. One of our retired leaders in psychiatry has been actively providing telehealth services across Connecticut and beyond over the last several days. There's numerous examples of people, nurses coming back to us, people who are volunteering, willing to come back and help any way they can. The outpouring of support, of sacrifice, of willingness to step in during this time period, it's both heartwarming and incredibly necessary.
And what kind of equipment do you need donated right now?
Well, I tell you, we've gotten a tremendous amount of equipment donated. We've seen construction companies come here unannounced to bring us masks and gloves. We've seen manufacturing companies come to us and bring us equipment and supplies. We've seen other healthcare providers, dentistry offices, veterinarian offices. We've seen ambulatory surgery centers bringing us ventilators because they're no longer doing elective surgery. So we've had a significant amount of supplies brought to us, and it truly is essential. It's one of the issue of personal protective equipment for people working in healthcare today is really amongst our very most critical issues. And we're doing everything humanly possible to protect the caregivers, the people who are standing up and providing care during this crisis. So we're working across the country, we're working regionally, and our community itself is stepping up and helping us during this process.
What do you say to the healthcare worker who might be afraid of coming to work and perhaps contracting the coronavirus? We hear reports out there that other cities are asking people to reuse the masks and things like that. And I know that some healthcare professionals are kind of concerned about that.
Dennis, these people are heroes. Truthfully, they're heroes every day. But you can see it now perhaps more than ever before. People who are coming in, the way I often describe it is during a situation like this, when many people appropriately and safely are being told to quarantine in their home and with their family, which is the necessary and right thing to do, people who work in healthcare are going into the crisis, and they're selflessly doing this. It's tremendous courage, it's tremendous bravery. And at the same time, I can assure you, with the CDC, we're following every guideline. We're working together at the state level and across all health systems in Connecticut. And we're doing everything humanly possible to protect the caregivers in this process. But I tell you, I just have enormous respect, enormous gratitude for the people who are stepping forward and caring for people during this time.
Many of our viewers right now are watching saying, what can I do to help? Because perhaps they're not medically qualified to go work at a hospital or something like that during this time. And I've read that in other states, people are actually making masks. These men and women are getting together and they are actually knitting masks out of special equipment, things like that. What can people at home do, and would you recommend something like that?
Sure. First of all, we've seen some incredible acts of kindness. We've seen, as an example, the Hartford Hospital Auxiliary is now supporting over 500 meals a week for staff members in the most critical areas within our organization, and they're partnering with Jay's Restaurant in the south end of Hartford. It's really incredible. We saw Bears, another local restaurant, come unsolicited and bring significant amount of food to support our caregivers. So we're seeing wonderful, wonderful gestures. At the same time, what I would say is go to our website, and there's great instructions there about ways of how people can help and how we're engaging our community, whether it's through donation of much needed supplies or people who have different skill sets that are necessary. So we're really working to coordinate volunteerism during this time. But the volunteerism has been amazing, and it's just a sense of community and what makes Connecticut so special.
Mr. Flaks, I want to touch on that heart that's next to you that says thank you. I know that you put an ad in today's Hartford Current with the same thing, asking people to put this in their window. And if you don't get the newspaper, you can always make a heart and put it in your window just to thank all the healthcare workers. I know I put something on Facebook yesterday with our own little message thanking them, and it got quite a response. People really do relate to the healthcare workers because they know that they are on the front lines of this battle.
People who work in healthcare are heroes. I mean, they really are. And when you look at what we're doing right now, a wonderful way to show support, to show visible support, is to put a heart on your door or in your window to signify that we're in this together. It's a wonderful thing to do. We're running this ad across all the papers in Connecticut today. It's on our website. We're trying to lead an effort to really connect the support which we see in our community and even provide it in a more visible way so that as our people are going to work every day and into this situation, they know that the community stands behind them.
Mr. Flaks, very briefly, if people want to help and donate food, bring food, they just shouldn't go to the hospital. Is there a number or a website they can check out?
Yes, go to hartfordhealthcare.org, and there's instructions about how to engage. We have people staffed full-time who are working and taking those requests. So thank you so much for everyone for your willingness to help and support us and all the hospitals across Connecticut during this time period.
Jeff Flaks, the CEO and president of Hartford HealthCare, we thank you very much for joining us. Have a great Sunday,
Dennis,
my friend.
thank you.
Stay safe. All right. In a moment, we will talk with one of our representatives in Washington and the mayor of the capital city. Last week's program was also dedicated to coronavirus with some great information from the experts. You can watch that right now on the WFSB app or our YouTube channel.